To add more insights on the COVID best practices in New Zealand, may we call back our Global Benchmarking Network Chairman. He is also the head of the Centre for Organizational Excellence Research, New Zealand, chairman of the Global Benchmarking Network, and co-founder of BPIR.com Limited, a leading benchmarking website resource that is used by many organizations in the United Kingdom. Ladies and gentlemen, please welcome once more Dr. Robin Mann.
Thank you once again for the introduction. I enjoyed Wayne's presentation. It was a surprise that he went before me, but as New Zealanders, we're known for our agility and responsiveness, and we've shown that through our COVID-19 response as well. In my presentation, I want to provide more of an overview of what's happened in New Zealand. I'm also going to touch on the United Arab Emirates. I was very interested to hear what Farah Niaz was saying in terms of all the innovations that have been put in place in Dubai. So I'm going to talk about that a little bit at the end of my presentation, because I was a mentor to a number of benchmarking projects supporting the Disaster and Crisis Management Committee for the Dubai government. Next slide, please. So I think you are all aware that New Zealand has had a very sort of high and good profile in terms of its response to COVID-19, and we've been mentioned many times by the World Health Organization, and there's been many articles written on New Zealand's best practices. What I'd like to do now is just play a short video. It's 2 minutes, which describes or gives you some insights into New Zealand's response. So please can we have the video?
Touching down on New Zealand soil in early February, around 200 New Zealanders rescued from Wuhan, China, the original epicentre of COVID-19.
They looked very tired, and as you can imagine, it's been a long trip.
They were quarantined at this Whangaparaoa Defence Force base as the virus began to spread.
They will not be able to come in and remain within New Zealand's borders.
At sea, cruise ships became floating petri dishes. The Diamond Princess, with New Zealand passengers on board, confirming over 600 cases. And then in late February,
the suspected case of coronavirus that we reported earlier today has been confirmed.
Life quickly changed. Gathering restrictions saw the memorial for the Christchurch terrorist attack called off, while sporting fixtures were cancelled altogether. Border restrictions tightened even further, arrivals told to self-isolate. Preparing for the economic blow, the government announced a $12 billion budget, including $5 billion for the wage subsidy scheme and a $900 million bailout for Air New Zealand.
This is the rainy day. We've put the umbrella up.
And then came the alert levels.
Over the past few weeks, the world has changed.
Less than a week later, it was level 4 lockdown, businesses and schools told to close.
I almost wish I hadn't sent her to school today. I've been stressing all day.
Panic slowly set in. The daily 1 p.m. press conference became a must-watch. The daily walk or exercise a big treat, including the local bear hunt. But on the 29th of March, New Zealand's first COVID death.
It is a very sad day, but it also brings home exactly why we are taking such strong measures.
April ushered in over 1,000 cases and ever-growing clusters, while Anzac Day saw Kiwis stand at dawn. Rest homes were amongst the hardest hit by the virus. Almost all of our 22 deaths were linked to aged care facilities, many of them unable to have family at their side during their final moments due to tough restrictions. Meanwhile, community testing had people lining up in supermarket car parks, but it was lining up at drive-thrus that marked our move down to level 3.
It sucked not having McDonald's open because I love McDonald's.
And with a steady decrease in case numbers, a drop to level 2.
I was just texting a bar I know to book a table for 6. So that's going to be a highlight.
Just seeing people again will be really nice.
And finally today, the news the country's been waiting for. Mikey Sherman, One News.
Okay, thank you. Can I have next slide, please? So you could see from that video that, COVID did affect New Zealanders' life lives. It meant for some people they couldn't go to McDonald's. So obviously that was a great inconvenience. But seriously, once we closed our borders and had the full lockdown, we have managed to address the majority of those problems. Apart from the economic problems to a degree, which Wayne was talking about, but the health problem has largely been addressed. And so since June this year, which is 6 months ago now, most New Zealanders have been living a completely normal life. So, you only need to wear a mask when you're on public transport. But apart from that, life just continues as normal. You can meet as many people as you want. You go to sport events. You wouldn't even know there's a pandemic at all for most New Zealand people. And in total, we've had 25 deaths in New Zealand, as shown on the slide. In total, over 2,000 cases, of which most obviously recovered. You can also see from the graph when there was those peak of cases at the time. In fact, over that period as well, over 1,000 cases around April, and that's when we had the full lockdown. And since then, we've had a few cases, usually each day, because generally there are people arriving at New Zealand and going into quarantine. And when they're in quarantine, obviously on their journey here or prior to the journey, they picked up COVID. But once they're released from quarantine, they should be COVID free. And we have had some cases in the community because obviously with border control, you have staff meeting the passengers, etc. Also at the ports, you're receiving goods. And so there has been some crossover into the community, but generally because of the track and trace system, we've addressed that almost straight away. So at the moment, you can see we had 2 cases yesterday, and we've got at the moment 52 active cases, of which 48 are at the border. These are all people in quarantine. Everybody has to go in quarantine for 2 weeks on arrival. And we have 4 cases in the community at the moment, and that they're being addressed at the moment. Next slide, please. So where is New Zealand internationally compared with other countries? You can see actually that even though we're heralded as a leader in this area, there are other countries probably even done a better job than us, such as Thailand, Taiwan, and Vietnam. So in terms of the number of COVID deaths per million people, a small country, 5 million people, and some of these other economies as well have been more open than New Zealand, but have been able to deal with the problem more effectively and had a more vibrant economy. That I think Thailand is still allowing tourists in, but they have to go in quarantine. In New Zealand, we only allow New Zealand residents to come back to New Zealand. So basically, we're a closed economy. I think Taiwan also allows visitors, but again, they have to go in quarantine first of all. Next slide, please. So what are New Zealand's best practices? I think you probably picked some of those up from the video. We had quite decisive leadership. But what I have said in brackets here, it's albeit after public pressure. So Jacinda Ardern, the Prime Minister, acted, but in many people's minds, she should have acted sooner, because the only way the virus can get in the country is through, the aeroplanes arriving, because it's an island. And so everybody was wondering, why has that not been addressed sooner? But eventually she did act because she was listening to the citizens. And when she did act, because she's respected and a fabulous communicator, people responded to that. But overall, I thought the approach was more like firefighting rather than being proactive. But certainly she's an outstanding communicator. And this is why she's well respected internationally, and therefore, very simple and clear communication. And you can also see on the slide as well, the various alert levels we have from level 1 to level 4. Everybody in New Zealand knew and understood the different levels of alerts, whereby, which will affect different people depending on the businesses they run, and also affect in terms of how many people you meet, etc. So it's very, very clear in terms of what's expected at each level, and everybody knew that they could listen to the Prime Minister, and also Ashley Bloomfield, who did a good job in terms of communication, who's a Director General of Health. Every day we could listen to him at 1 o'clock in the afternoon. Also, New Zealand has an elimination strategy which differs from many countries. So trying to totally eradicate the virus on our shores, with although expecting it to come back, because you still can't close off the country totally. Even with quarantine, it can still seep in. But once it comes in, you try and eliminate it again. So again, best practices, strong border control, and also, as Wayne was talking about, is lots of assistance to the economy. Other factors that assisted New Zealand was a low population density, also a generally compliant population who listens to the government. And I also genuinely think we had quite a bit of luck as well. Next slide. There are opportunities for improvement. We were initially open, and I think we were too trusting, first of all, that people arriving in the country would go into self-isolation. So initially we didn't impose quarantine on people. But this seemed quite ridiculous to me and to many other people, that you have international visitors coming here as tourists. They're only coming for 2 weeks. They're told to self-isolate for 2 weeks, but no way would a tourist self-isolate for 2 weeks if they spent all that money to come to New Zealand. They're not just going to stay in a hotel. So I think the government was a little bit, they could have done things better in that case. So we were slow to close borders initially. Also, we're not very good at testing the passengers, and we're not initially very, very, very good at all in terms of testing the border control staff. So even though the borders were closed, they were dealing with still the visitors, and we were not testing the border control staff, who were actually, in many cases, dealing with those passengers. So what we're poor at is actually lack of quality systems. So we're good in terms of policy, but in effect, the systems were not deployed. And I think that might be also a characteristic of New Zealanders. We're quite laissez-faire and not good necessarily at imposing systems on people. And this is why we had that firefighting mentality rather than being proactive. The other thing is, which relates to Wayne's point of view, is that we're slow at exploiting New Zealand's position. We are very privileged. There is virtually no COVID in New Zealand. Everybody feels very safe, and yet the economy is going downhill because it's totally closed off. So we're missing out on international tourists. I have a part-time job at the university. This would be an absolutely fabulous place for international students to come to, but no international students are allowed into New Zealand at the moment. And therefore our universities are being decimated because they depend on international students. And we should be able to have systems in place where all international students go in quarantine for 2 weeks and then come to university. But we have not got the capability to put in those sort of quality systems. So in this case, universities are losing their staff. So lots of people are losing their jobs at the moment because we can't put in place simple quality systems. Next slide, please. So in terms of a business excellence perspective, and you could examine all countries from this perspective, this is showing the Baldrige criteria, which is one of the business excellence models, and it's used in the Philippines. The basis of all these models is a set of core values and principles, and they're shown in the center of that circle and also on the left-hand side of the slide. And I've ticked those core values and concepts in which I think we've been good at in New Zealand, like valuing people, organizational learning and agility, management by fact as well. We have got lots of good data, with good scientists here, social responsibility, ethics and transparency. So we're very clear about communicating with our people. And so this is why the government acts on based on the perceptions and understanding of the citizens to a particular crisis. But we're not good at a systems perspective. I think we've got strong leadership who can communicate well, but I don't think it's visionary. And there are other aspects as well that I think we could actually improve on. Okay, next slide, please. I think the difference with New Zealand and a country that was being talked about previously from one of our presenters, Farah Niaz, is that while New Zealand has some facets of excellence and business excellence, you would see in other countries like the UAE, they've totally embraced business excellence. It's led by the government. And so it's mandatory for all government entities to use these business excellence frameworks as a means for improvement. And it's mandatory they use benchmarking as well. And I don't just mean looking at what your neighbours does and not really finding out in detail what they do. It's in UAE, it's a very systematic approach to benchmarking. In fact, these are projects I've facilitated for the UAE over the last few years, over 35 benchmarking projects. And looking at, for instance, making Dubai the safest place in the world to have a heart attack, from other projects, making sure that Dubai has a fantastic system for ensuring, baggage is safe when it's loaded onto the carousels at the airports. Next slide, please. And because of the experience of government entities using benchmarking, then I was called upon very early in April to assist with Dubai's response. They set up 5 benchmarking teams to support the Disaster and Crisis Management Committee in Dubai to do benchmarking projects that would directly inform the government of what to do. And they were using the trade best practice benchmarking methodology. Next slide, please. And so as part of this approach, they set up 5 teams. One on food security, another one on communications, another one on crisis management, another one on health, another one on societal behaviour, and each team did a systematic project. And this is showing here the work of one team reviewing the crisis management approach of Dubai, breaking it down into the issues that they're facing, identifying the gaps from which they would learn best practices. And you can see there a fishbone diagram showing the main issues they were focusing on, and you can see the fish swallowing the COVID virus. Next slide, please. Once they understood the problem they were facing, the opportunities they needed to address, they could then search for best practices. And this is where, they're acquiring best practices. Again, doing rigorous desktop research, as well as following up with, phone calls to experts, talking to people around the world, trying to learn from them. So this is a breakdown, for instance, for the crisis management area, the areas they were focusing on. Next slide, please. And you can see, so we're learning from other countries was in fact from New Zealand in terms of, how, as I said, Jacinda Ardern was doing such a good job in terms of her outstanding communication. So they were learning from that, as well as best practices from other countries. Next slide, please. And from that, they were then feeding that information through presentations and a final sort of best practice report to the Dubai government, who could then take actions on that and implement those best practices, some of which you heard previously from Farah Diaz. So we can go to my next slide. I think that concludes my presentation. So you've heard from this session the perspectives of New Zealand, and previously you've heard, I think, the perspectives of the Philippines and also the UAE, and also from Dawn from Canada. And I think now it's a question and answer session. So thank you very much indeed for your time.
Thank you for that enlightening presentation, Dr. Mann.